There are a lot of people to get to know in a dementia unit, so it's best to prepare yourself in advance, also in the resident's voice. So firstly, the village manager, she'll take you for a superficial tour about the place. Then there's the unit manager of the dementia unit, who deals with everything in terms of overseeing the operations. Then the charge nurse, medications, doctor's appointments, dressings, diet, weight, sleep, anything to do with socialisation, go to the charge nurse. Now the carer, the all-important primary carer, he does the showering, dressing, hair washing and toileting. Very important to gain a good working relationship with the primary carer. Day-to-day functioning happens at that level, so it's good to get to know them, liaise with them and update them on anything that's important in terms of your parent. Now, for example, the really important thing is to work out when is the best time to talk to the carer, because they are so busy. They each have, say, 8, sometimes 9 dementia residents to look after, colossal workload. So whilst they'll be happy to speak to you, they won't volunteer it. So you need to find a time that suits them when they're not so busy, or when they can do their tasks and talk to you at the same time. So really, the best time for that is after the showers. So find out when your mother's going to be gets showered each day. Say, for example, maybe it's 10 o'clock each morning. So you can come in after the shower, say 10:15, then you're there just as your mother's getting dressed, or halfway, or, even if she's just completed her dressing and the carer's right there, say putting on the shoes or stockings or whatever. You can talk to her as she's doing that and do all the updates. A very good time, because she's with your mother, she's just done the showering, she's about to dress her, and often so many things are about dressing in terms of what you'd like to inform the carer of, in terms of lipstick or creams or perfumes, or how your mother likes her hair done or whatever. Now, a really important thing is shoes. It's really important to explain to the carer what the most comfortable pair of shoes for your mother is, because sometimes what happens is the carer can put your mother in sandals, and I have seen sling-back sandals being put on a dementia resident with stockings. Can you believe that? Trying to get around in that when you're 90 or whatever. I mean, there shouldn't be sling-backs in the wardrobe anyway, but sometimes the carer looks at what they would like to wear for themselves. Maybe they're 20 and they love sling-backs with pantyhose. Well, fine, but not for a 90-year-old woman. So you need to come in as the relative at dressing time and see what it is your mother's being dressed in, and tell the primary carer what works for your mother, and ask her to put it in the notes, so that when the primary carer is not there, either leave or holiday or time off, the other person can read the notes and continue the process. So that's one example. Another example is if your mother's going to the hairdresser, it may well be that the hairdressing appointment, maybe she has it once a week, she doesn't need her hair washed. I mean, I've seen in the dementia unit so many times relatives invest in, really it's often the funding of the dementia resident, isn't it? So the relative or the dementia resident has their hair done beautifully, and then the next day the carer's washed it, all the curls and set and everything gone. So even though things are noted, it just pays to double check, triple check even, go through it. The personal touch, personal communication is really what helps in a dementia unit. There's the formalities, of course, that always happens and has to be there, but it's that personal touch, day-to-day level, relationship building, lots of positive, important things happen at that time. So I've written about all these topics in the Resident's Voice and the Resident's Rise, everything in the description below. Thank you for your looks, likes and subscriptions on YouTube. Thank you so much.